We are really delighted to be here today to do three things. One is to really inspect what is going on, the work that is going on in JM Hospital, which is the largest hospital here in Nyandarua. Mpesa Foundation is going to be spending 60 million to build a new maternity and child care unit, postnatal child care unit, that will also include theaters, will include modern equipment, will ensure that we transform the ability of mothers to deliver safely, but also the ability of newborns to grow, and also for any issues that they have, that they can be addressed in the right way with the right medical attention in the right hospital. It will also be a unit that then can accommodate a lot of referrals from across the wider county, which is really, really important. And from what I understand from the hospital management, there have been constraints, people sharing beds and so on and so forth. That will be now a thing of the past when this is done in a few months to come. We are very happy with the governor to have inspected the work that is going on and is progressing well, and we are looking forward to coming to hand over the maternity and the nursery unit to the hospital management in 3 to 4 months. We will also be doing a couple of additional. We are investing in a school called Mombi, which is near here. I will be handing over the school. We have spent almost 69 million to do classrooms, 16 classrooms, and includes abolition blocks and all the other facilities that the school has. Tomorrow, I will also be holding a medical camp.
Happy to see the progress. I think we've seen almost 3,000 plus patients already. The exciting thing around what we've done is around the innovations and partnership with Mpesa Foundation, what we, and other partners, KISE, AMREF, Lions, and what we've done in providing access to healthcare and continuity of care. Improved access to systems. We have an ECG booth now. Ultrasound is becoming very important. Everything is tied into, different pillars. So women's health. Every woman who goes through the process is onboarded on the Women's Health Platform, Petals, where they're able to engage, an OBGYN, engage nurses, mental health support, nutrition support within that community. Similar for NCDs, and we've seen that with an extensive bouquet of services in the NCD 10, from cancer screening to arthritis support, hypertension and diabetes. But most importantly is the fact that we've adopted a multidisciplinary approach. So you have a nutritionist, you have a mental health support, all embedded within various places. So I get excited to see how very organized it is, very well branded, looks very good, very orderly, and we're excited to work with the Nyandarua County in ensuring that access to health is here, and all big thanks to Mpesa Foundation's push and generosity into supporting access to healthcare in underserved communities. And like we say at Zuri Health, healthcare is a fundamental human right. Everybody deserves access to affordable healthcare.
Niko hapa, nimetumwa na mkubwa wetu, His Excellency the Governor, to support the team which is on the ground, and also to give them moral support as we appreciate the partners, Safaricom and Mpesa Foundation, Zuri Health, Lions, KISE, and even our healthcare team which is on the ground to do medical screening for our people, our citizens. And this is a very good arrangement because we have a very large turnout, and really, as we echo what the CEO of Safaricom attributed to yesterday, screening is very key, and also that is what we support under UHC, because if you are able to catch these conditions early, then the success rate in terms of treatment is quite good. There is also the aspect of share registration, which we are really emphasizing on it because we want to make sure health care is affordable to every Kenyan. And we must appreciate Zuri and Safaricom because also they are doing assessment for the most needy clients, and they are going to support them in payment for 1 year. And thereafter, as county will also come in. So we are going to work very closely with them so that those patients, they don't lose in terms of healthcare management.
Yeah, I was aware about, I got it through the media about today's event, and I was keen to come and attend it because I've been having underlying health conditions, especially with my body. And when I came here, I went through the process, through the tests, and eventually got some medication, and I've really liked it. Yeah, the condition has been high blood pressure. I've been having it for quite a number of years, but of late, the medication has not been working very efficiently. So I got a test today, and they changed the medication, and I got a different kind of medication, and I'm now hoping that this will be much better than before. The entire exercise was very good from the registration. The crews are very well organized. I went through the registration process, was very well and fast. And the people I met in the different desks, from prescription, from the tests, and including the pharmacy section, they were very friendly people and very professional in their work. I would like to tell Mpesa Foundation and Zuri Health and the county government that this is a very good gesture. It's good corporate social responsibility that is reaching the grassroots people. And it's very effective. And we'd look forward to having more of this, and probably even have more days than 1 day, because I'm sure by the end of the day today, more people will be aware of it through those ones who participated. So it has met quite a good reaction from the community, I'm sure of that. And we are grateful.
At Safaricom, we have been sponsoring medical camps across the country. We've done 49. This will be the 50th medical camp. We get between 3,000 and 6,000 people coming to the medical camps. They have been extremely popular. Many people who have really never discovered they have certain conditions, they get diagnosed for those conditions. The most important thing about medical camps is better to have diagnoses that happen early instead of waiting when it is too late. We can also then have the data that allows for the county to follow up with the patients to ensure that they receive the right support.